On today's episode of the Nashville Wellness Collective podcast, we have nurse practitioner and owner of Hi Finch Med Spa, Kayli Krasnow, who is here to demonstrate how health and wellness integrates seamlessly into the beauty industry. I am your host, Unique Cortez. The Nashville Wellness Collective is an online directory and resource with a large list of health and wellness practitioners in the Nashville area that span from Eastern to Western practices and everything in between. So whatever kind of practitioner you are looking for or interested in learning more about, the Nashville Wellness Collective is here to help. Visit us at TheNashvilleWellnessCollective.com and watch or listen to all of our podcast episodes, read our blogs, and much more. Go ahead and tap that like button and leave us a rating, as it really helps the channel. If you have any questions, go ahead and leave them in the comments. Now let's find out the latest and greatest cutting-edge technology in the med spa industry. Without further ado, I give you nurse practitioner Kayli Krasnow. Thank you for joining us today.
Thank you for having me. I'm so excited. I appreciate it.
You're so welcome. And before we start, you offered me some water and you were like, please tell me about.
I'm obsessed with Liquid Death. I'm obsessed. It's like the best plain sparkling water and the best like canned water. So we're going to pretend they're sponsoring our podcast today.
Thank you, Liquid Death.
Thanks, Liquid Death. Cheers.
Cheers. Yeah. And congratulations, because Hi Finch has hit its 3-year anniversary.
Yeah. 3-year anniversary this month. So we're very proud.
Happy birthday.
Thank you so much. Appreciate it.
Hi Finch. So Hi Finch is a medical spa.
Yes.
And you have a plethora of offerings. Yeah. And you and I met at a wellness event here in the Nations in Nashville. And when we met, she was telling me all about BBL. And I was like, girl, the thing that makes your butt bigger. Not Brazilian butt lift, which is the only BBL I'd ever heard of. And then you explained to me, no, it's a skin treatment that helps with your skin. And then I'm a runner and you're a runner.
Yes, yeah.
And you were telling me, like, runners especially, we're always out in the sun and we're training for this and training for that. And I agreed with you. And I was like, oh my gosh, girl, sometimes I feel like it's like I have to pick between one or the other. It's like I want beautiful skin, but then I'm like, oh, but I want to run. And and you were like, this is the answer.
Yeah,
like,
absolutely.
You don't have to pick. And I was like, oh, I'm all ears. So please, will you tell the audience what BBL, not the Brazilian butt lift, what BBL is?
Yeah. So BBL stands for broadband light. It's an intense pulse light device that's made by Cyton. Don't tell everybody else for all my services like this, but I love it. I think it's probably my favorite treatment because you're right. We have been out in the sun for so long. So, broadband light is a light-based treatment. It's not a laser. It doesn't break the skin, but it uses different wavelengths of light to put that power into the skin to treat different things. So we can do collagen stimulation. We can treat hyperpigmentation. So sunspots or age spots, whatever you want to call them. But we can also treat acne scars, rosacea, and skin tightening, and perform skin tightening, So it is a really nice treatment for people who spent a lot of time in the sun. But one of my favorite things that we talked about was that it actually creates some genetic rejuvenation, which I really like. So the sun hastens the visible aging of the skin. And so a lot of times when we are triathletes or swimmers or runners, we've got muscle, but we've got like thin, saggy, wrinkly skin. And so we look much older than we actually are or than we actually feel. And so BBL is my answer for that. Like we can reverse signs of aging. We can perform some genetic rejuvenation so that your cells behave like younger cells. And and that's why we can actually see slowing of aging as well. So I tell my patients, I'll look like this 10 years from now.
Wow.
That's what I want to. That's what I want to do.
Amazing. Your
that's really
skin's
sweet.
like glowing.
Thank you.
Taut. Is taut the word? Yes.
Yeah. I love it. I'm obsessed with it. So
that is amazing.
Yeah.
So okay, the genetic. Can you explain?
Okay. I am not a geneticist, but I like to talk. I like to talk in layman's terms because that's how I talk to my patients. Because most of them are not geneticists either.
No, right. Not
And
a doctor here.
Dr. Patrick Bitter, who's a dermatologist up in Northern California, he conducted a study with Saiton and the BBL Hero, and it was a 10-year study. And kind of essentially what they saw was when we're young, we have young genes. Mm-hmm. And as we age, those young genes get turned off and old genes get turned on. Mm-hmm. And with consistent BBL treatments, so that means a few treatments up front spaced 1 month apart, and then a treatment every 4 months over years and years, showed that we can actually reactivate the young genes and deactivate some of the old genes. And so our cells start behaving like younger cells. So rather than having, I'm going to copyright this. I'm saying it right now. I'm copywriting, trademarking. I don't know what that means. Is it a verbal thing? Is it like declaring bankruptcy? You can't just declare bankruptcy out loud. You got to do something about it.
I'm not sure.
I'm going to say
what?
no.
Because when this airs, then that's kind of like your copyright. So when it airs, you know,
so
somebody,
I'm calling it.
Yeah.
Okay.
So we'll air this.
So I say, like, our cells get lazy and crazy as we age. So they stop making collagen. They stop recycling collagen. They stop producing elastin. So the stretchiness and the support in our skin. And then they get crazy because all of this sun damage and all of that UV damage and radiation damage that has happened over our lifetime makes our pigment making cells, so our pigment producing cells, it makes them go crazy. And so we get sunspots and unwanted freckles or big spots on our cheek. And so the BBL can help reverse those cellular behaviors so that our cells aren't so lazy or crazy anymore.
Lazy and crazy, ladies and gentlemen. It's trademarked here. You heard it first. But that is crazy.
Yeah.
Just the whole explanation of that. And so BBL can help reduce that effect from ever happening.
It's really special. So it's important to maintain it though. So I always tell people too, they're like, well, my freckles came back. And I said, well, I haven't seen you in 2 years. You know, we still it is still something important to maintain. You know, you can't use sunscreen once and then it helps for life. Or you can't use your moisturizer once and expect your skin to be dewy and smooth and hydrated for life. You know, you have to continue to use it because our skin is always exposed to the elements. So.
Yeah, that makes sense. And you mentioned that it does a multitude of other things like freckles and fine lines. And so it sounds like it does everything, but is that like every time someone comes in for a treatment, it treats all of those things?
Yeah. So it depends on what we're working on. So if somebody, I will use myself an example. And so you can see, like, I'm not freckled.
Right.
But when we put my skin under UV light, under what's called a Woods lamp, it looks like I'm covered in freckles. And so what the BBL has done is it has reduced all that visible sun damage. So I don't appear freckly.
Whoa.
But so I just think it's really neat that we can maintain it like that. So now with my treatments, I don't have to do the pigment pass to treat pigment, because I don't have any visible pigment.
Okay.
But I do have little patches of rosacea on my cheeks right here. So each time I treat myself, I do treat for rosacea because it'll come back after 3 months or so. I notice like my little red bumps will come back on my cheeks there. So
do you have invisible freckles?
I do. It's kind of crazy.
That is, yes.
It's really weird. I'm very freckly. It's very strange.
Yeah, because I see none.
Yeah.
That is so cool.
Yeah, I am wearing like a tinted sunscreen, a tinted SPF.
Yeah,
but it's not a full coverage foundation or anything. Like
it's
if I had freckles, you'd be able to see it.
Yeah, you'd be able to see. So. Oh, that is so cool. And
it's so
it's
strange.
Neat that it does all of them. But you said you can kind of tailor it so there's like a specific pass that you do for different things.
Yeah. Okay. So I have some people who specifically come in and we're treating their acne. So I see them every 10 to 14 days for an acne treatment.
Okay.
So we do the blue light pass, which helps to treat the acne bacteria. And then we do again, layman's terms, like a redness pass to treat those red hyperpigmented spots that people get after they've picked at their acne, which we all do.
Yeah.
I love to pop a pimple. I'll be very honest. I'll tell you that too. And I like to pop my own pimples. Like I know I'm not supposed to say that, but I do. And I feel like that makes people feel more comfortable and less guilty. It's human nature. Come on.
I mean, it's trending all over social media. It's like oddly satisfying.
It is so oddly satisfying. That's one of my favorite subreddits. And then at the end of a acne treatment, we do the skin tight pass with the infrared light, which helps reduce inflammation and control oil gland production. So we can see some really dramatic improvement in acne. It can be really life changing, which I think is also so important. So yeah.
The infrared light, that reminds me of Kristen from Urban Sweat.
Yeah, she's the best. They have a really neat facility over there. Yeah.
Hey, Kristen, we love you. Kristen! Yeah, and her infrared, and she was telling me
she's the red light.
All the benefits for the skin.
Yes.
So that now I'm putting all the pieces together.
Yeah, and that's why people see overall like brightening of their skin, even skin tone, reduction of inflammation.
That's incredible. And I love how you said, I know people with acne and, just trying to make yourself feel better in the skin that you're in is very important. And here at the Nashville Wellness Collective, we're all about spanning the gap between Eastern and Western health services. Awesome. So we say we've got you covered from East to West. Yeah, and I like to interview people that span from like a breath worker, Reiki master, all the way to medical MD, family practice, and everything in between.
I love that. So I think that's so important. And I think it's so valuable for so many people, because some people they may go see their physician and they may come home and do yoga and do breath work, and they may want to figure out how they can combine some things and find the best combo of things that work for them. So.
Yeah. And I think a medical spa is a great example of like that kind of middle ground where you have a little bit of all the practices and it blends together very nicely. And taking care of yourself and the skin you're in and feeling good about yourself also ties into mental health.
Yes, absolutely.
And if you want to maybe touch on or give an example of someone or maybe a testimony you've heard, maybe somebody that comes in for acne treatment and how it's like changed their life, their perspective on themselves, that can be very touching, I think, for an audience to hear, like, look, it's about your mental health too.
Absolutely. So I tell people, like, we are human beings, and so it's part of our human nature that we are self-aware. We're aware of what we look like. We cut our hair or style our hair, we wear makeup, or we choose to wear something, whatever it is, you're making a choice. And so it's normal for us to be sort of self-conscious about what we look like or want to look our best, whether that's for ourselves or for someone else. I try to encourage people to look your best for yourself so you can feel your best about yourself, and not feel that outside pressure. But, I think it's so important for us to look and feel our best. And I truly believe everybody has good skin. Sometimes, and I say sometimes we just need to find it. Yeah. So, So, I've had like 2 different experiences that just like first really come to mind. I have a lovely person who comes to me for acne treatment, and she's let me share her journey on our Instagram. She was really nervous about doing it at first, and when she saw her before and afters, I said, I don't have to show it. I want everybody to know, like, there's no pressure. But she goes, no, this needs to be seen, because it can be so life-changing for someone else to know that there's a possibility of help out there, because she had tried a lot of modalities to treat her acne, and it just wasn't working. And so something that she said was, she had gone outside the house to the school library for the first time, like in the last like 10 years. I mean, she's young, so she like in the last 10 years without any makeup.
Wow.
And so like that, she's like, that's life-changing, because now I don't have to worry about putting on a full face of makeup every single day. I can just go out like I want to and just leave the house and not worry that people are staring at me.
Oh my gosh. It makes me a little teary-eyed.
I know. So that was like, that felt really, really special that you get to help someone in that way, because a lot of people think of what we do as like, well, it's Botox. Like, you just care about what you look like and blah, blah, blah. And I'm like, well, no, you can truly change someone's life.
Yes.
And that's how I feel. I mean, I'm sure my mom will listen to this. Hi, Mom. Hi. But something that we've been working on is I've been doing Sculptra treatments on her. And Sculptra is an injectable medication that stimulates collagen and elastin production. And when she looked at herself, when we compared her before and afters, she just teared up, because I think she feels that she looks older than she is. And when she saw herself, like in the comparison, she just, you know, she just started crying and was just so happy and thankful. And it's not about feeling like you want to look glamorous and put on a full ball gown and be photographed and things like that. But it is about feeling comfortable and feeling like, it's nice to know how other people's, like, I don't know. That's a hard thing to say, but she just feels good about herself.
Yeah. It gives you
it's
a
for her.
sense
It's
of
confidence.
There we go.
Yeah, it's confidence. Yeah.
Confidence is the key.
Yeah.
And it really matters, I think, how you view yourself. So when you look into that mirror, what do you see?
Yeah.
And do you feel beautiful?
Yeah.
And when you feel beautiful from the inside out, you radiate that confidence.
Absolutely.
And confidence to the world and the world around you. So just like walking to the library without the makeup on and feeling confident enough to do that. So I love med spas and practices like yourself because beauty, it's not just beauty. It's not just the surface of the skin we're talking here. It's so much more than what people make the beauty industry out to be.
Right.
It's like mental health too.
Absolutely.
It's like from the inside out, all of the layers.
Yeah, absolutely. And something that we really focus on, I'm going to like segue.
Yes. Yeah.
Is like people always ask what our name stands for. Like Hi Finch. I try to say hi to everybody I know. I always, like, if I'm just passing someone on the street, I may not know you, but I'll look you in the eye, I'll smile and say hi. And I once had someone when I was going through nursing school tell me, like, a lot of people just don't look at me and don't acknowledge me. And so when you said hi and just smiled, he said that like made my day because a lot of people don't do that. And that was something, you know, that was years and years ago. And that just really made an impact on me. So I just try to just smile and say hi to everybody, because what harm is that doing? Like, what does it cost you to do that and do like the nicest, smallest, it's like the smallest gesture you could possibly do. So I want to portray that we're friendly here. Because we are. But then finches are how Darwin came up with his theory of evolution. And his finches all have different beaks because they're all eating different things, whether that's seeds or bugs or nuts. And so, and they were parts like from different parts of the world and different parts of the islands and the Galapagos and things like that. And so something that really radiates to me is we all look different because we're from different parts of the world. Like you and I look different. And that is what makes us beautiful and interesting. Oh my God, and so I don't want to change your essential evolutionary features and make you look like someone else, because I don't think you should have to look like someone else to feel like you look pretty or look like you want to look or feel confident. You know, I love that. I mean, I think Kim Kardashian is really pretty. Yeah. But I don't want other people to feel like, well, if I don't look like Kim Kardashian, then I'm not pretty. Or if I don't look like whoever, Kendall Jenner or any of the Jenners. They're all so pretty. They're also pretty. So I want you to feel good about yourself. So sometimes it's like, well, maybe you feel like you look a little tired. Well, we can fix a little something to make you look tired, but people aren't going to say, you had your cheeks done. Right. Okay. It's, what did you do? You look so good. You look so fresh. Yeah. Yeah. So that's what I want for people is I want them to be guessing about why you look so fresh, not like, what did you do? Why do you look different? Right. So you look well rested. Yeah. Yeah. So rejuvenated. Yeah. Did you have an energy drink today? Yes. Yeah. You drank 2 cups of coffee. Yeah. Exactly. Maybe slept through the night, like whatever it is. Yeah. But yes. I love that. I mean, especially moms with young children and oh my gosh, getting that sleep, or at least looking like we got the sleep through the night. Exactly. Yeah. Works wonders. So I know we were tying in like the mental health aspect of it, but we can kind of segue into how all of your services here benefit the mental health, and we're steering clear of that whole beauty industry. What's the word? Kind of like trope? Is the trope a thing? I don't know where it's good. Like stereotype. Stereotype. There we go. We're steering clear of the beauty industry stereotype, and we're talking about how it actually blends cohesively with mental health and just your overall well-being. And can we talk a little bit more about
all of the services you
Sure.
offer here.
Yeah, absolutely. Yeah. So I kind of like always segue with my patients, like when we're doing a consultation, I tell people, we do injectables. Injectables are so fun. They're going to make you super fresh. But injectables aren't for everybody. So injectables may be like Botox or Dysport that help with fine lines and wrinkles.
Okay.
It may be filler, which can give you plump lips, or we can contour your cheeks, make you look a little less tired, or contour your jawline or your chin, whatever we're looking to do. So I kind of think of those as like my really fun things.
Yeah.
And then we have our skincare treatments as well. So we have our microneedling, which can help with acne scars and fine lines and thickening up the skin so you have smooth, plump, thick, radiant skin.
Yeah.
We have our chemical peels. We use the VI peels, which I love. I don't know if I'm supposed to be talking about brands or whatever, but I mean, I'll talk about them because I really like them.
Yeah.
So the VI peels were formulated for any skin type, no matter how fair or dark your skin is, or no matter how like dry and sensitive or oily and acneic. So there's really something out there for everybody, whether or not we're treating skin tone or hyperpigmentation or acne, or just wanting like just smoother, radiant skin, which is one of the reasons why we chose that brand. I like that it's for everybody, and they're really effective, which that's what we want. We want effective treatments here. And then we talked about the BBL, which is really fun. And then so the injectables, I think we talked about Botox and filler, and then fillers. And the last thing was the Sculptra. So the Sculptra is an injectable, but it's not really going to change your face shape. It's just going to restore that skin tightness, to give you a little bit more of a youthful look, and just like maintain that collagen, that like support in your skin and that stretchiness in your skin. So
does the Sculptra, does that create more collagen?
Yeah, so it is a medication. So just like, ibuprofen can reduce inflammation in your body, or, a blood pressure medication will reduce your blood pressure by doing certain things in your body. The Sculptra will induce collagen production. So it kind of tells your fibroblasts to start making collagen, so that we see improvement in loose skin, wrinkles.
That's that an injectable?
It is also an injectable. Yep. So we inject it underneath the surface of the skin into that tissue, and then it stimulates those fibroblasts, to stimulate collagen production and produce collagen.
You said it's also an injectable, so it's also you said medicine?
I think of Sculptra more as a medication because it's telling your body to do something, whereas some people confuse, and like Botox and Dysport are also medications that do something to your body. So, but filler, I think, is more of like a hyaluronic acid. We're still prescribing it for whatever we're doing, but it's more of a gel. It's not telling your body to do anything or have a reaction. So that's kind of the difference between like Botox and Dysport and Sculptra versus fillers.
Gotcha. And then on your website it said, let me get the acronym right, PRF.
Oh, thank you. Yes, I knew I had another one out there. Yeah, so PRF stands for platelet-rich fibrin. So that's a treatment where we draw your blood. So if we were doing a treatment on you, we use your blood, not my blood. We draw your blood and we spin it down in a centrifuge, and we take off the plasma portion of it. And that plasma portion of the blood is kind of like the clear part that kind of looks like apple juice. But there are platelets and little fibrin strands in there, and growth factors. And when injected back into your tissue, like maybe underneath the eye or into the tissue around the mouth, that's also causing a natural reaction in your body. And it's the PRF, when injected, is kind of telling your body, hey, something needs to be healed over here. Something needs to be fixed. And so we see an increase in collagen production and healing in that area. So there's increased blood flow to that area. And we start to see healing and tissue rebuilding. So that's why people, when we do it underneath the eye, feel like their eyes, the skin in their eyes, around their eyes, looks tighter, looks smoother, looks brighter, because we've got that kind of like healed skin, essentially.
Oh my gosh.
I'm big on layman's terms.
No, I love that because my friend just had that done, and I was like, oh my God, you look great.
It's like, so nice.
It's so subtle too.
Yes.
I was like, first of all, I never would have guessed your age. And second of all, I was like, your skin just looks so like nice and taut and pulled back. And like, she was like, that is all I do. And like, it helps And she was like, and I just go in every now and again for a little maintenance, you know, she's like, but it works wonders.
Yeah, it is really lovely. And that's like when kind of like an East meets West type thing. It's all natural. You know, it's not using, there's no medication in it. I don't even use lidocaine in the product. So really it is truly your body's own wound healing abilities or healing abilities that, that give you these results, which is really nice for a lot of people, because some people don't want injectables. Some people don't want Botox or Dysport or fillers or Sculptra. They say, how can I do this more naturally? And I wanted to make sure that we have those options.
That's really cool. Yeah, because to each his own, you know, whatever, whatever your journey to wellness is, hey, we're here for it. And we're here to support it. And then one more thing I saw on your website that I was like, what is that? Starts with a K, Kybella.
Oh yeah, Kybella. Thank you for remembering everything you do for me. Yeah, so Kybella is it is an injectable medication. And so it can be injected underneath the chin here for what we like think of as what we think of as a double chin. And so it essentially permanently reduces the fat in that area, barring any major weight gain. So for people who kind of want that, like more of that sharper, like under the jawline area, or have a double chin, we can really nicely reduce the double chin area, which is really fun. So
do you have anything for, like, you know, when you hit 30, I feel like it happens like right at 30.
It does.
And the necklines.
Those little necklines. So they've been there. You're born with them. If you go look at all these little fat babies with their little neck rolls, they've been there.
That's true.
I'm going to call people out. I'm going to call them out. I don't know who them is, but I feel like there are things that we kind of create, like problems to fix the problem, you know? So we've had these lines, and yeah, they do get worse as we age because our skin does get looser. But that, I'm going to be very honest, it's a really tricky area to treat. So we can put Sculptra in those areas off label. We can do little bits of filler off label in those areas to help with those fine lines. We can microneedle. Microneedling is where we stimulate collagen production, which will help thicken the skin and stimulate collagen production, which will help reduce the appearance of those lines. But I usually tell people we can reduce the appearance. We're never going to make them go away though. That's so I do also set realistic expectations in my office. But yeah, they do kind of get worse as we age because our skin gets looser. So if we can do a treatment to just keep our skin nice and tight, even BBL, which stimulates collagen production, then we can keep that skin nice and plump and healthy with that collagen production, and then reduce the appearance of those lines. But they were always there.
Thank you for mentioning that, because now that I think about it, I'm like, oh my God, she's right. Because think about baby pictures.
These little fat baby rolls, like their necks are like little, like little donuts.
Donuts. Upon donuts.
Little Michelin men. But their like necks are like that. And their little thigh, like who has a thigh roll right here? Babies.
Babies do. Oh my gosh. Yes. That's hilarious. What's like that dog? What is it? Bulldogs?
Like a bulldog or Shar-Pei. Shar-Pei. Like, yep.
Exactly. Oh, I also had a friend recently that got Botox for a medical reason for her TMJ.
Yep.
Can you describe to us a certain or a few different situations where a person might have like some kind of health issue where you're like, oh my gosh, injectables actually help with that?
Yep, absolutely. So there are a lot. So there is Botox, and then there's Botox Cosmetic. Botox Cosmetic has been studied for 3 specific areas and FDA approved for 3 specific areas, treating our frown lines here, our forehead lines here, and then our little crow's feet around our eyes. And then there's Botox, just Botox. And so that has been FDA approved to treat things like migraines. To be completely honest, I don't know if it's actually FDA approved to treat masseter muscles, but off label in my, I use Botox Cosmetic in my practice. Off label, I do treat the masseter muscles. And so, some people genetically have enlarged masseter muscles. That's just, that's something that they're prone to. So it can make your face look a little bit wider at the bottom, or maybe what people think as a little bit more masculine. But some people have issues with TMJ. So TMJ is, temporomandibular joint joint disorder. And so that is pain in this joint here. So some people experience just pain, achiness, popping, catching even. And sometimes that can be related to maybe they clench their teeth really hard due to stress, or like myself, when I started wearing Invisalign retainers, I always kind of bit down on them to make sure they fit, like that, make sure they're on. But then that kind of got me into a bad habit of clenching. So now I clench. So when I wake up at night, like shake out my face because I clench so hard. So clenching, grinding your teeth. So clenching and grinding, or chronic gum chewers, who chew gum, like they go through a pack a day.
Oh no.
Yeah. So like when you're chewing gum, or when you're clenching or grinding, think of it as like lifting weights for your masseter muscles, and you're just like bulking them up and bulking them up. So if you have a problem with enlarged or hypertrophied masseters, or if you have a problem with TMJ, and you happen to be a gum chewer, that's the first thing that I tell people is to cut it out, because then you're just like going back and like chewing gum and like bulking those little muscles up.
Looking like Arnold Schwarzenegger.
Yes. Yeah, exactly. Like little like workouts. So that's the first thing that we cut out. But essentially what we can do for people with TMJ who have enlarged masseter muscles is we can inject Botox in those muscles. And by weakening that muscle, essentially it will shrink down to kind of like what is like a normal size. And then you can't clench or grind as hard. It shouldn't affect the way you chew or speak or swallow or anything like that. But if you can't clench or grind, then you're not putting the pressure on your teeth or that joint. And so we can protect your molars from getting like ground down to being flat, which means less risk of cavities. We can prevent your enamel from chipping. I had a patient a couple weeks ago. I said, have you ever, has your dentist ever told you this? Or have you ever chipped or cracked a tooth? And she said, yeah, I literally just had a crown replaced because I clenched so hard I cracked my crown, which can be thousands of dollars worth of work, I've heard. So like that's something where we're protecting your teeth in the long run.
For your teeth.
It's insurance for your teeth, exactly. And then we can also prevent premature aging of the jaw, because all of that pressure can cause premature aging of your jaw bones. So in the long run, that is a really nice health benefit of getting Botox in your masseters. So we usually recommend speaking to your medical provider, or your dentist may have told you that, hey, clench or grind, or maybe you're out there and you wear a night guard to protect your teeth, but you still have jaw pain, or you notice that your jaw, your lower face is a little bit enlarged or bulky. Or some people have noticed like, hey, over the years, I just feel like my face has gotten wider. Which normally doesn't happen. Like your bones don't just like usually grow wider unless you have a certain sort of disorder. But when we talk about that, we can feel on that and see if that's maybe the issue.
Yeah. So. Wow.
Yeah.
Is there any other example you can give us of something else that Botox or any one of your services treats, like a condition of like health that people wouldn't normally expect? I feel like TMJ was one of those that I was like, whoa,
that's a really good one. Yeah, a lot of people don't recognize it, or they don't, or I'll point it out and they're like, wow, I never thought of it before. And then they come back for their follow-up and they're like, I don't have headaches anymore. And I didn't really realize I was dealing with headaches. And now that I don't have now that I'm not clenching, or now that I feel like my muscles aren't as bulky, like I don't have headaches anymore, which is really neat. I have some patients who come in and get their Botox for their headaches here, but they really like the side effect of having a smooth forehead.
Of course, who doesn't?
But so that can help with people who are stressed, or who squint, or raise their eyebrows when like looking at a screen all day. That can cause some tension. So some people have noticed that like when they've gotten Botox in their frown area or their forehead, they say, I look great, but I also now I don't really have my headaches anymore, which is really cool. So
oh my gosh, you said looking at a screen, and I just thought to myself, like, that's me like 12 hours out of the day.
Yeah, for sure. It makes sense that we're squinting over time. So yeah, for sure.
And then the bright lights too, I feel like from your cell phone and your computer screen, I don't know what kind of damage that does to like the retina or what, but I know it's doing some kind of damage. And definitely can cause headaches.
Yeah, absolutely. So, and then the BBL, like we're talking about that, part of the study that they saw at Stanford over the years was that they saw a difference in how many people ended up with skin cancer at the end of the study. And so with that genetic rejuvenation and keeping your skin healthy, along with wearing sunscreen every day, because that was part of the study, was that they saw a reduction in skin cancer in the patients that were getting BBL. So if you know you've been outside for a long period of time, you know, like I was, if you've ever been severely sunburned and had blisters, you know, from a sunburn, you're at an increased risk for developing skin cancer in the future. And so that's something, I mean, being very fair skinned, I mean, I burn so quickly. You know, I was starting to get sunburned on Saturday watching my nephew play soccer, and I'd only been outside for 5 minutes. And it just happened to be a hot day. So I was like, sunscreen, like I was just rolling it on. But I know I've definitely been sunburned to the point of blistering. And so now I'm like, how can I reduce my risk of skin cancer for sure? Because that's scary.
Oh my gosh, absolutely. Wow. So skin cancer, guys, this is like a big deal. We're
get a
talking
BBL.
about, like,
and it can not this one. That is not going to help with skin cancer. No, but you know, I don't want to say it's a guarantee by any means, but like if we can reduce the risk,
reducing the risk of skin cancer, I feel like that's a big medical health issue that a lot of people need to think about, and nobody wants to get, obviously. So why not? I feel like you provide little ways of ensuring different things for longevity.
Yes.
And so I feel like the BBL is a good way to invest in yourself as you can think of it as a form of insurance for not getting skin cancer, for your skin,
absolutely.
of keeping youthful, glowing skin, but healthy skin more than anything. And then, like we talked about, the Botox injectables here, and that's kind of a form of insurance for your teeth. Keeping them all there and in place and not messing up crowns is going to cost you thousands of dollars later. And then also the headache issue that I was like, wow, I've heard of that one too. That can help with headaches so much. So Botox and is it Dysport? Dysport. And Kybella. Are these all like along the same lines of like they make a muscle stop moving?
No, so that's Botox and Dysport. Kybella breaks down your fat cells.
Breaks down the fat cells.
Yep, exactly.
Okay.
And then Sculptra produces collagen. So they're all kind of doing something different. So it just depends on what you're looking for with your treatment. So some people say, can Botox fix these lines here? You know, and no, not really, because I'd have to paralyze your full face so you couldn't talk or speak or smile anymore.
Oh my gosh.
But then your face wouldn't fold here and you wouldn't have these lines.
Yeah.
But can I really paralyze all of those muscles? No, that's crazy. So when we talk about these lines, that's when we would say, well, these are the different types of things that we could do. We could do microneedling to stimulate a little bit of collagen production to help minimize those. Or if someone has deeper folds, then that's where we could add filler, certain types of filler in those areas to help, smooth that out. So
well, that makes sense too. With back to the TMJ thing, because when you mentioned like lifting weights is like if you're grinding or pressing, putting a lot of pressure, and you're using those muscles, you're like building the muscles. But so when you inject it with that, it kind of makes the muscle not work, not get its workout. And so like, oh, well, exactly.
So it just, and so if anybody's ever worked out before, which it sounds like the people who listen to this podcast work out, if you've ever then not worked out for a few months, which I'm sure we all have as well, you notice you don't look as tight and toned or as bulky as you once used to because you lose that muscle mass. So that's essentially what we're doing with those masseter muscles there. Putting them on rest, on bed rest. We'll talk a little bit about our skincare if that's okay.
Yes,
I mean, our skincare that we have, it's pharmaceutical grade. So we have, you know, the purest active ingredients, which are super important. And when we went back to talking about the BBL and being educated, you know, you have to protect your skin. You have to wear sunscreen. And that's something that sometimes people are like, well, I wear it sometimes, or I only wear it when I go to the beach, or I don't like wearing it because it's oily and I can't put my makeup on, or it's in my makeup. And I say, do you wear your makeup every day? So finding a really nice sunscreen that you can wear every single day, again, insurance. And, you know, I also think of skincare as insurance for your treatment that you may have just spent hundreds or thousands of dollars on. You know, you need to protect it. And so that's one reason why I also say, like, we act as personal trainers for your skin.
Nice.
So that's kind of what our little tagline is, because, most people don't work out with a personal trainer every single time they run or they work out or they lift or whatever they're doing. So you still have to do things outside of that. You may work out with a personal trainer once a week and then you go home and you do your exercises the other days. And so that's the same thing here. We do a lot of the heavy lifting here with our treatments, but at home, then you still have to maintain it. And so, quality skincare is really, really important. Our products, like I said, are pharmaceutical grade skincare. And our sunscreen is just like my favorite thing. We have our sweat-proof sunscreen, like our sport antioxidant sunscreen, which you can wear, which is doesn't run when you sweat. But then I also love our sheer lightweight sunscreen because it goes on really nicely under makeup. So you don't get like a white cast whenever you're in a photo or just walk around like your ghost. So I love those. Like those are two of my favorite products that I wear. I wear at least one of them every single day, no matter what. So I think of sunscreen as what's something you do every single day in the morning when brush your teeth. Yeah. So that's something I tell people, like 99% of people answer that way. Someone said something strange and I don't remember what they said. And I was like, most people don't do that every morning, but you may. That's okay. So if you do that every morning, you should also be pairing that with your sunscreen.
There we go.
So I just know that if I've brushed my teeth that day, then I have put on my sunscreen that day as well. It's just something that you grow up knowing. And I think I would love for everybody to feel that way. It's like, oh, you wash your face and you put on your sunscreen. And that's something that I do over the weekends is, I'm going to be honest, I don't go through the whole rigmarole of putting on all my skincare products on a Saturday morning. I splash water in my eyes to wake myself up, and then I put on my sunscreen and brush my teeth. Yeah. Because I'm outside, I go for a run, I go to the farmer's market, I'm running errands, and I just want to get going. And maybe I'm dirty because we've gone for a trail run or something like that. So I'm not going to like do all the things just to like go get truly dirty. And so, so if you're doing one thing, choose sunscreen.
And if we're doing more than one thing, what are your other favorites that you want to mention?
Okay. So I love using a retinol because sunscreen can help prevent, signs of aging and sun damage. So it can prevent wrinkling because UV light breaks down collagen, which creates more wrinkles. Okay. So that's why people living in Florida that don't wear sunscreen have more wrinkly skin because they're closer to the sun. They spend a lot of time out in the sun. So sunscreen is like that kind of age prevention of those signs of sun damage and aging. I think of a retinol as helping reverse those signs of sun damage and aging. Okay. So it stimulates collagen production. It helps with pigmentation in the skin, helps with overall skin texture because we're shedding our skin at a more regular rate. So we have smoother, dewier skin. And then retinol also helps treat acne. So you have two like really heavy hitters with sunscreen and retinol. So if someone says, well, I mean, I'm basic. I don't want to do anything. Like I just want to keep it super simple. That's fine. Use face wash, moisturizer, sunscreen in the morning, face wash, retinol, moisturizer at night. You have 3 steps, both morning and night, and you're going to see fabulous results. And then the other things are fun things that you can add in if you have other issues that you're trying to treat, or if you just want lots of hydration and have dewy skin, you can throw on hyaluronic acid or whatever. But I kind of think of the other things as extra. But those are the 3 basic things that you always need, or 4 basic things that you always need.
And you said face wash. What kind of
We have a lovely papaya enzyme cleanser. It's safe for all skin types. It removes makeup. It removes microscopic particles. It's safe for post-procedure. So if you just had microneedling done and your skin's kind of broken and scabbed from that, then you can use your, but you can use the face wash on that. So it's great for pretty much any skin type. So, and then I love our baby face moisturizer. It's so lovely. It smells so good. But it's also really hydrating and goes on really, it's not super thick, but it's super hydrating. Like it feels really luxurious.
Hydration, sunscreen, retinols, and then everything else kind of a little bit extra.
Just add it in. Add it in as you want to or can afford to. Yeah.
Oh, and retinols, is there a certain time of the year that's best to use it? Somebody told me like
all year long.
All year long?
Yeah. Yep. Okay. Use it all year long. Why? Because you're going to be wearing sunscreen every day.
Okay.
Yeah. So that will help protect your skin from any sensitivity.
Awesome. So that clears that up. And then one last question. Did you hear Kristen Calaveri on a recent podcast where she said she does not wear sunscreen?
No, I didn't hear that.
She does not wear it. Now,
I can do that again because my lip flip's worn off.
So what do you use for the
lip flip? Is Botox in the upper lip, and it
Okay.
can help give you like a bigger lip when you smile. Essentially, it prevents your lip from rolling under.
Okay.
For some
Mine
people who
does
have
it.
like a smaller, a lip bone. Yeah. So I got one a few months ago because I let my other nurse practitioner like do one on me, so she practiced doing the procedure, even though I didn't want one, or not that I didn't want one. She did it. I volunteered, but I didn't need one.
Okay, yeah.
My lip was huge. I couldn't really move it. I
Taking one for the team.
I couldn't whistle. I can whistle again. It's nice, yeah.
Well, nice that you could do the horse
Wait, so
sound.
she doesn't wear sunscreen?
She doesn't wear sunscreen, and the clip I saw was just a really short clip where she said she doesn't wear sunscreen. But then later I saw another clip where she was explaining like she has the makeup that has sunscreen already in it, but then she's like, there's ingredients in sunscreen, and I'm not sure what ingredient in particular she was talking about, but she was like, it's not healthy, or she read somewhere that it's not the safest to use on your skin every day. I can't remember exactly what ingredient she was referring to.
I don't know.
But that was kind of her explanation on it. But I know she left basically everybody in the beauty industry gagged with that statement.
So sunscreen is kind of like an over-the-counter medication, and so it has to be FDA approved. So if I wanted to go out and like just completely make a sunscreen from scratch, I would have to get FDA approval. And so sunscreens and sunscreen ingredients are not just like whatever ingredients think we could block the sun, and whatever ingredients whoever thinks they can make, whatever brand has made a sunscreen or is putting out a sunscreen out there has had to go through FDA approval for that sunscreen. And there are different types of sunscreen ingredients. There are physical sunscreens that actually reflect the rays so that the rays of sunlight do not get absorbed. And then chemical sunscreens, actually the chemicals in them absorb the sunscreen and scatter it so that it's not absorbed deep into the skin. So there are two different types. I really like one that has both, so you're getting maximum protection. So I like a physical plus chemical sunscreen. But physical sunscreens are typically have like zinc or titanium dioxide, so you can typically see them. So they look, if you think of like the old lifeguards that had like the white nose or something, like just like a zinc sunscreen. So like a plain physical sunscreen can sometimes be more prone to leave that white cast and be harder to rub in, versus a chemical sunscreen usually is what they call more cosmetically elegant. So it rubs in and looks a little smoother. So I like both because I kind of want that maximum protection.
Yeah. So, wow. I did not even know that. There's a term for Okay. Well, thank you for explaining.
My pleasure.
Thank you so much for all of this information.
Thank you for asking.
Oh my gosh. I feel like our audience got so much value.
I hope so. I really hope so. Yeah.
If you like this kind of content, please give this a like, a follow, all that jazz. I will put Hi Finch in the show notes so you can give them a follow.
Thank you.
And check out all of their skincare line online. You can order that from anywhere in the world. Yeah. They will ship it to you. And then if you're here in the Nashville area, they're here in the Nations in Nashville. Yeah. So
stop on by and say hi. Yeah. We love it. We love to see new faces pop in. So
thank you. Thank you guys.
Thank you.
Thank you for tuning in to today's episode of the Nashville Wellness Collective. Like, share, and follow us on social media at the Nashville Wellness Collective for exclusive content and giveaways. Thank you again to Kayli Krasnow, nurse practitioner and owner of Hi Finch Med Spa. To contact Kayli and her team, view our show notes below for all of the details. And if you would like to be a guest on this show, please visit us online at TheNashvilleWellnessCollective.com or check out the link in our bio. Follow so you don't miss an episode. Until next time, the Nashville Wellness Collective has you covered from east to west.